Distinguished guests, ladies and gentlemen, it's my honor to present some background discussion material about establishing sharing and the perspective through the cooperation in science, technology, and innovation. So the mission of most Ministry of Science Education has four major tasks. The first one is promoting national science and technology development. The second one, supporting the academia research and cultivating the talents. And the third one is facilitating academia and industrial cooperation. And the last one is developing science park. I will show very quickly about our mission. So the first one, you can see in this slides that our government to put a very steady growing of the budget for our national R&D commitment. The red line showing the government's R&D budget. As you can see, as for 2016, we have around 3.4 billion US dollar. And among the national R&D budget, most got 1.5 billion. And also I want to report to you that actually the government R&D only share about 25% of our nationwide R&D budget. So the private sector actually contribute more of the budget for science and technology development. With this amount of budget, certainly we need to build up some R&D infrastructure. So in most, we have three very outstanding center or research laboratory. The first one is the National Synchrotron Radiation Research Center. And I'm proud to announce that just last year, we finished the second new National Synchrotron Radiation and also the new B9. So please play the video. I can show you how it is very important for us. This kind of new facility can do everything from the natural science, the bio, the engineering, the material, and even the brain. So we are shooting worldwide top research. So we already cooperate with the B9 or the Radiation Center in Thailand, in Australia, in Germany. And the second one is the National Science and Technology Center for Disaster Reduction. Taiwan is a very beautiful country and island, but we still have the gift from the God that to challenge our daily life. So we have typhoon, we have earthquake, and sometimes we have very heavy flood. So through this center, we actually set up the disaster prevention, management, and also the prediction. And the third one is our National Applied Research Laboratory, the so-called Nano Lab. We have 10 centers. Also, it covers from engineering, bio, natural science, or even for some social science. So with this infrastructure, our researcher, our institute can make a very outstanding research through the very expensive facility and do international cooperation. And this slide shows the overall budget arrangement of our most budget. 55% are for free research, the so-called curiosity-driven research. So the professor can do a button-up research, shooting for the future knowledge and the possibility to use in the industry. The 25% is for a mission-oriented research, that is kind of top-down, to match our national policy, to persuade the outstanding research that the worldwide now is already see the possibility for the new technology. And certainly 26% is on the infrastructure that I just showed you. Also, the other most important issue for most is we actually developing science park. As you can see from the slides, we have 3 clusters. The largest one is in the northern part, so-called Hsinchu Science Park. And then we have in the southern part, we have the Southern National Science Park. And finally, we have the park in the central Taiwan. As you can see from the number, the employee, according to last year, is more than 269,000 employees. And the revenue in USA dollar is about 79 billion. So I think it's the most important part that Taiwan can be so-called the technical island. Certainly, knowledge of all the R&D, the society will ask why we need this so many budget. So we also focusing on the academia industrial cooperation. So I just show you 4 major sectors. The first one is the industrial academia cooperated research program for a small to medium-sized enterprise. That is, for the small and the medium-sized company, they may not have the capability to do a very advanced research. So we just have the academia and share with the SME. And we certainly also like to shooting for the major innovative technology that can be our future pillar for the economical growth. So we have pilot grants for the major alliance. And the third one is we encourage research to establish laboratory to promote core technology derived from research. So we have a bridge program such that professors can focusing on their research, but the program, the office shooting for the bridging of the IP, of the technology from academia to industry. And the last one is using the legal entity to link industry and academia cooperation pilot program. And how about the talent? If we don't have talent, then everything is not real. So from research to commercialization, we also like to cultivate our talent, especially the young people. So we have the germination program that is fostering an entrepreneurship culture of transferring innovation into startup within university campus. So we do support some very outstanding university to set up their own startup or entrepreneur center. And certainly in most, we also have some basis for them to set up the startups. And we have accelerator program. Once you have the idea, once you think the technology ready, then we should accelerate the procedure. So we have accelerate program. And then if they're really shooting for the international market, we even send a team to Silicon Valley. We have an office in Silicon Valley such that the team can go to Silicon Valley for 6 months. They can, in there, they have our advisor such that they can meet some company or venture capital that can get the funding, that they can shooting for the international size. And the last one certainly is our funding, the so-called Taiwan technology funding. So through these 4 procedures, we'd like our young generation can be not afraid of failure, but just do it through the support of the government. And in this slide, I just show you some of our highlight of our government. So certainly we need some policy through the review of our current status. So for the next stage, Taiwan industrial innovation, as you can see, is a link with the future, linkage with future, linkage with the global resource, and the linkage with local communities. And we have highlight separate of the the target. For example, it's a smart machinery. Everything should be smart. Asia, Silicon Valley, green energy. Okay, we like in 2025, everything should be, the green energy should be a major portion of our electricity supply. And the national defense focusing on the cybersecurity, and the biotech and the pharmaceutical. So that's why I think in the coming forum and the panel, we were more focusing on the bio discussion, and also some innovation, and also some of science and technology cooperation. Circular economic, new agriculture, digital economic, and the technology for culture and IC design semiconductor. I think Taiwan is the #1 in semiconductor manufacturing, and I think also #2 in IC design. So we like to use the strengths of Taiwan ICT to support all the next industrial innovation. And I think today, this forum is for our southbound policy. So I will more show the geometry of our global outreach. So we already have 15 Leon's office in 13 countries. And in this division is enhancing bilateral and the multilateral science and technology cooperation and strengthen the regional networking. So in this slides, I just show you the national science southbound policy is not merely a trade value-based policy. It's about people. It's about sharing. It's about sharing the perspective and sharing the region. We can work together to make our better life. So the NSP program broadened the bilateral and the multilateral exchange and the cooperation in regional neighborhoods in areas such as technologies, culture, and commerce. So we'd like to aim to establish a new foundation for partnership with South and the Southeast Asia country. So the aspect of NSP program can be divided into 4 categories. And in most, I just highlight the section that in most that we can do more. So it's about the cooperation in infrastructure building, promoting the staff exchange. I think last month and this month, I just traveled around the Southeast Asia country. I also see for Southeast Asia country, they also like to nursing their young generation such that they can have young and more challenge to the future technology. So I think we can share and we can make many cooperation. And certainly it's about the science and technology and the cultivating industrial talents. And through the sharing, we can have some strategic planning and alliance. So we have 5 flagship program, also target for NSP program. And the program is like the joint development of science and technology talent. I think also in the Southeast Asia country, and there are many young talent that we need to educate them and also promote them to the level that they can meet the challenge of the future science and technology. So the policy forums and the young youth exchange platform should be set up. And also, I think regional agriculture is very important. We like share the same ocean, we share the same, likely the same climate. So agriculture is very important for us, not just eat enough food, but eat better food. And also medical healthy cooperation and the industrial supply chain. I think we have our own regional characteristic about the requirement of medical and healthy problem or system. So that is a very good chance that we can cooperate with each other. And also innovation is very important, such that we can catch up the industrial leading country. So the new southbound policy partner cover the Asian Oceania, 10 countries, and the South Asia, 6 countries. So it's also including Australia and New Zealand. And in this slide, I show you our policy about doing the science and technology. So it's about the capacity building, and also the enhance of operating efficiency, and incorporate with government 5 flagship program and priority countries and the teamwork. So through our Overseas Science and Technology Innovation Center, we already set up 6 centers around this region, and also the bilateral talent incubation. I think we can do more. And I just show in this year, we have the so-called foreign or joint research project, or even discuss about the future direction just with our partner. The first one is with Philippines last September. Our DM Shyh and the Guava of DM of Philippines, we also review our program. And in the middle part is just last week, and I just come back yesterday. We also have a joint forum and a discussion and the signing ceremony with Indonesia, with their Ministry of Science and Technology. And in May, we also do the same things for India. And I think APEC is a very important platform. It's an economic body, and all the almost all the Southeast Asia country join this platform. So as you can see, this is the PPSTI partner policy for science, technology, and innovation. Actually, it's quite fit to what I just tell you. It's very important through this platform that we can share our technology and the innovation. So I think this is the challenge that we discuss in APEC is about Science, Technology, and Innovation Center. So as I just report to you, we set up 6, and we will set up more. And the center is about the research cooperation. It's encouraging the exchange and the training of talent, promoting innovation, operation, and the technology cooperation, and meeting the need of host countries and our friends. So in this discussion and about the bilateral incubation of talents, I think we have separate programs. The first one is the joint research and the training program, and the recruiting talents to participate in research projects in Taiwan. And also we support some of the Taiwan scholarship for them to study in Taiwan. I think our Ministry of Education do more as this, but for most, we are more shooting on science and technology and for the PhD student. So I just show you one example in here. So please play the video. As you know, the climate change do have effect on our Earth. So in Taiwan, we make this kind of challenge. As I just say, we have a very good technology in this area. I'm sorry, this is in Mandarin.
有许多和激烈天气有关，但是我们对于气候却不了解。那又该如何来度过这个困境呢？我是虫虫，现在我将带领大家一起来了解什么是气候，而气候变迁又会对我们产生什么样的影响。
So this video is also supported by most. We do some technology, science and technology translation, and have the video and teams to do this kind of a video or movie such that the public can know more about our challenge. So this is the last slide, and is the conclusion of my presentation. Assuring and prospecting platform science and technology and innovation. I think I already addressed many of the aspects. I will not repeat again about all the points, and I think in the forum and the panel, the attendees will discuss more about it. So I think building cooperative partnership of science and technology, university, government agency, and the industrial innovation, we can do more. Thank you for your attention.
Thank you, Director General Zhou. Now, without further ado, may we invite Deputy Minister of Ministry of Science and Technology, Dr. Fong-chin to give us his presentation.
Ladies and gentlemen, good afternoon. I think it's a great pleasure to share with you some experience about so-called Global Academia Industry Alliance, especially to focus on medical device area. I think our Director General, Professor Jerry Zhou, just shared with you that a lot of policy and funding to promote so-called new southbound policy, and through MOST. Actually, there are a lot of programs already, and I think it's very important to have one example to illustrate how important and impact to our society, through realistic collaboration, especially in healthcare. And I think later I will share with you some concept, especially also to introduce you the so-called Taiwan Biomedical Industry Innovation Program. We know that Taiwan actually it's very important role in the world, in biomedical industry. And this slide just shows that so-called Taiwan industry status. We separate into so-called applied biotech, pharmaceuticals, medical devices, and welfare. And actually, the growth rate actually is around 6%, per year. And Taiwan government actually right now select biomedical industry innovation is one of 5+2 industry innovation initiatives. And we know that, wait 1 second. And actually, Taiwan actually have a lot of strengths, especially in healthcare. So you can see that according to the report, I think from so-called Telegram Media Group, actually Taiwan tops the expert healthcare charts. So you can see that actually Taiwan, in terms of quality and affordability, in healthcare, you can see Taiwan actually in right up corner, and you can see USA is here, right? UK here, USA, yeah, somewhere along here, and actually, Taiwan actually top, in healthcare, because we know that in the United States, actually Medicare become more and more expensive and costly. So especially in Asia for Southeast Asia country, I think the affordability become critical issue, in promoting healthcare technology. And also the right chart, actually right graph illustrate that the ICT industry index in Taiwan. And you can see that the inner loop, actually that's top average, top income countries average. But Taiwan actually in average in terms of all index, actually much better than top countries. So how to take advantage of the strengths of Taiwan to promote healthcare become government policy. So I just mentioned that there's a so-called Taiwan Biomedical Industry Innovation Program, in order to promote Taiwan as an Asia-Pacific biomedical industry hub, and in order to accelerate biomedical industry to boost the economic growth and consolidate public health, and to promote social welfare, especially in aging society. And the strategy of a biomedical industry innovation program in Taiwan actually try to establish so-called ecosystem, innovation ecosystem. So, including talent cultivation, topic selection, provide sufficient resources, even refine regulation, also how to protect intellectual property, and the fund for startup company and entrepreneurship. So we have several important strategy to promote Taiwan biomedical industry. And just give you some idea, actually right now the whole project actually try to establish so-called biomedical corridor from north to south. Actually, I'm supposed to say that in south, about 8 years ago, Taiwan Science Park established so-called medical devices industry cluster. Actually, I would like to appreciate our former president of National Cheng Kung University, Michael Lai. He is in the audience, and he is a key person to establish and promote the Southern Taiwan Science Park medical device cluster. And in central Taiwan, there's a central Taiwan Science Park. Actually, there are several so-called minimally invasive surgery technology developed in that in Taichung. And in Hsinchu, actually, right now we try to establish important environment ecosystem, for incubation of medical devices, new drug, and also establish a new branch hospital of Taiwan University Hospital there to, for development of biomedical industry. And in Taipei, actually, so-called Langang, there's a National Biotech Research Park, actually focused on new drug, and the whole infrastructure will be completed in the end of this year. And this I just mentioned that Hsinchu Biomedical Science Park. Actually, I would like to use medical devices as one example. So in Hsinchu Biomedical Science Park, actually, I just mentioned that this is the area just by the high-speed rail station in Hsinchu, and we establish incubation center, and we are going to establish a second building, for incubator. And also one important hospital is under construction, and we will be completed in 2018 or 19, and actually become important area, to facilitate biomedical industry. And we know that if we use medical devices as one example, we know there's a complicated procedure, from prototyping to, and for validation, animal for in vitro validation, even for the so-called pilot run in a clinical trial to GMP preparation and market application to product test. Actually, it's so complicated. So actually, it's the government provide a sufficient ecosystem, in Hsinchu Science Park to help each sector in this whole procedure. And one example, actually, Taiwan government established co-laboratory, in Hsinchu Biomedical Science Park, and to for biochip development, also for IVD services. A lot of set up, a lot of hardware there, and this is the other example, including imaging facilities, even active manufacturing facility, also product, a lot of so-called material, like here actually for mechanical testing, and they in Hsinchu Science Park. Actually, there are many startups, company established in Hsinchu Science Park already, and also there are several animal facility center, including Thailand, Southern Taiwan Science Park, also Hsinchu Science Park, and also we most is going to set up the other animal facility in Langang, actually National Biotech Research Park. And I just mentioned that Southern Taiwan biomedical device industry cluster. Actually, in that cluster, it was established about 8 years ago, and right now in that cluster there are 54 companies, set up, established in this cluster. And in the pharmaceutical industry, actually there are 11 companies, and the other 7 companies in biotech industry. And this the bar chart shows that the number of certificates in cluster. You can see actually we had a lot of certifies of our medical products, from FDA, even from CE mark. And this one shows that, and also Taiwan actually is, I think, one of the best country for clinical trials. So this slide just shows that the number of clinical trials actually right now is, in Taiwan, and you can see that actually most of them actually is multinational clinical trials, actually in Taiwan. So I think for new drug development, clinical trial actually is very important. So Taiwan actually is one of the best country, for clinical trial, because we have best medical doctors, in the world. And so we can say that actually Taiwan is well equipped, at 18 value, and in terms of infrastructure setup, even talent cultivation, even a lot of strategy, in promoting the biomedical industry. And because this section actually is innovation, technology innovation, and I would like to highlight actually in general, the value creation actually is a core value to promote all innovations. So how to promote core value? Actually, Professor Jerry Zhou just highlighted, we send a lot of talent to be cultivated in Silicon Valley, and we also learn a lot of experience from Stanford. And we must think that in Asia, in Asia country, actually we have a different demands, different people. So we must learn a lot of experience from the United States, from the Europe, but we must set up our own model, in Asia. So actually, for example, in 2012, the famous Professor Tom Fogarty actually taught me, do not emulate American experience. We can learn American experience, but do not emulate. So actually, it's very important to have this session to discuss potential collaboration in Southeast Asia and East Asia countries. And especially for medical devices, actually, we need clinical needs, research, development, design, even manufacture and services back to the hospital. So actually, many stakeholders, are required to work together, for value creation. And I would like to say that actually this the slide I used to promote a medical device innovation center at Chengdong University before I relocated to Taipei for most. I would like to appreciate the vision and leadership of our former President Michael Lai, for his establishment of a Medical Device Innovation Center as a center of excellence through the grant of Ministry of Education. And I think it's very important to do that. So I would like to say important idea about a so-called GAIA, Global Academia Industry Alliance. I give a name, so-called GAIA. Actually, it's a system where everybody wins. Since we would like to initiate realistic collaboration, we must think the benefit of each body. So how to find a strategy for find a policy, to promote a model. So how to promote GAIA actually highlight from innovation to value creation. And probably you don't know, I think the Malaysia and Indonesia people know the SATU. SATU actually is a President Forum started about 13 or 14 years ago at National Cheng Kung University as a President Forum from Southeast Asia and East Asia countries. And it's a great opportunity to develop so-called GAIA model, through help of a SATU platform. And because we highlight technology innovation, and right now the most actually provide a lot of funding, right, for potential collaboration between Taiwan and Southeast and East Asia country. And I just highlight Taiwan have a strength in manufacturing, especially not only ICT, also precision manufacturing. Actually, Taiwan actually is in leading position in the world. And branding actually is important policy. So usually how to branding in each country. So actually through the collaboration, probably usually I say that if we have alliance through every country, then probably we can promote our own brand product. We don't need to use the costly product from USA, from Europe. So I think Taiwan can play important role to reach the collaboration, in biomedical product. And through this collaboration, we can overcome a regulatory barrier, right? And to take care of the health care of our societies. And meanwhile, I think we can cultivate global talent. It's very important. Usually I say, I give example, in Google, in Apple company, actually, they are rich to hire the most smart people to work with for them. But actually, in countries of Southeast Asia, East Asia, actually, we may short of money, but we can work together. So as long as we work together, actually, we can compete with the big giant in the world. So I think it's very important to form an alliance, to work together. And this give you some actually the achievement during past years. I think Dean of Osman here, actually later he will join the panel discussion. And we have a long-term collaboration with University of Malaya, and actually in 2014 we signed a MOU, which endorsed by former Minister of Economic Affairs, in Taipei. And at the time, 7 companies joined this signing ceremony, and so you can see actually a lot of companies show on the panel of College of Engineering of University of Malaya. And actually we learn a lot through communication and collaboration. And this year, I think September 1st this year, NCKU launched the first so-called GAIA hub at the UN. Actually, it's very good example to set up one, to have a space and to establish the hub, to promote realistic collaboration between Malaysia and Taiwan through this hub. So we can you can see this actually grand opening on September 1st, and you can see a lot of facility set up in the one famous building in University of Malaya. Actually, is a just new so-called industry innovation building with a grand opening on last November. And this shows several companies work with National Cheng Kung University and to establish realistic collaboration. Actually, the facility there can be used as educational purpose for design, even can be used in the hospital. So actually, there are a lot of great potential to do that. And the other example, actually later we have one most important guest from Vietnam, University of Medicine and Pharmacy, Ho Chi Minh City, actually Professor, President Tran Tet Tuân, actually Professor President Tuân, and actually we have a great collaboration, and we are working with Southern Taiwan Science Park to establish the other realistic research base in UMP in November, yeah. And this one actually last year we also already go with several representatives from Taiwan companies, several medical device companies to visit UMP. And I think so the former section related to education, and right now we know that each top university actually cultivate many foreign students from Southeast and East Asia, and I think it's very important to hire the student actually educate in Taiwan to work with Taiwan companies and Vietnam university even companies. So for this kind of model, actually National Cheng Kung University, NCKU, actually also hire the people to work there, to link. So this one just highlights some important message related to so-called Gaia. Actually, Gaia also the God who create the earth. So I like the Gaia term actually. And so the goal actually, to summary the goal of the Gaia actually to identify the impact of the research on society from both economical and social perspectives. And the Gaia can bring together different stakeholders working on scientific research, innovation, and industry in the world to develop a shared vision on collaboration and develop a common area of dialogue. It's very important to have common area of dialogue, especially for healthcare, and also share different experiences and successes and failures, especially failures. In Taiwan, actually, we already accumulate a lot of failures. So I think it's very important to, either locally, regionally, and globally, and also discuss the policy, law, and regulation. Because policy, law, regulation actually is most important part, in promoting biomedical industry. And there are several advantages. We are impact to, to economy and society by innovation and value creation, even through the mutual compensation, right? And also cultivate, as I just mentioned, that cultivate highly talented human resources. Also leverage experience and network in global exchanges of education and research. And there are a lot of advantage for academic universities. So you can ensure the knowledge gain will become a product with a resulting benefit for society. Also enable the development of a better, far-reaching, fundable research plan and tapping into financial and technology resources provide greater visibility, to academic research. And you also have several advantages for the industry. So that's the reason I say that it's a system where everybody wins. So, academic can provide higher qualified researchers. I mean, human resources also access to a long-term independent research. And more importantly, for marketable new pattern. And also access to next generation knowledge and obtain global view of a research trend. And also collaborate with highly trustworthy players in society. So I think that it's very important to establish joint research centers. So actually, through the newspaper, probably in Mandarin we say that 接地气吧，接地气. That means connecting to the ground, connecting to the local societies. Actually, it's a very important idea. In order to connect into local society, local needs, only set up a research base, in the country, and have several employees to work in there, to work there. So I think it's a very important idea for this one. So I think to this one, you can say that in Mandarin said 四两拨千斤吧, program defect 1,000 of a kilogram. So I think it's a good policy and model because usually the medical devices for pharmaceutical company promote their product for link to university, through a so-called exhibition, through and usually it's so difficult to connect the industry companies to a university. So if we can invite different stakeholders, to form one entity, within one alliance, so then we can have a more impact. So I just give you an example at National Cheng Kung University. At Cheng Kung University established one new graduate program for medical devices. And the major faculty actually from 10 actual faculty position from mutual education. And the 10 new faculty actually with different background. For example, right now, one actually with expertise in business model, one on regulatory, one, 2 or 3 on actually medical doctors, and some of them, graduate from engineering school, actually to integrate different people working in the same department, and also important to link to the industry, to the foreign country, especially in modern digital age. It's easy for collaboration through the internet, I mean the IoT. Especially we know that actually the Taiwan biomedical industry innovation program will pay more and more attention to so-called smart for intelligent medicine. Smart intelligent medicine, actually for digital medicine. Actually, then it's very important. I know that it's easy to have collaboration through the internet and through the intelligent technology, So I think it's very important that, to this kind of the model. And actually, Taiwan is a center, in East Asia. So I think more and more collaboration are welcome. And later, I think we can have a discussion about how to promote technology innovation through collaboration, And the key issue is the value creation. Actually, that's a core value. Everybody must think that value creation to benefit each stakeholder. Okay, this is the end of my talk. Thank you.
Thank you, Deputy Minister Su. And now I'd like to welcome all the panelists for this particular session to move on to the stage, please. Thank you.
Okay, I think in the beginning, I would like to introduce all panelists. First of all, actually, according to the program, we have a guest from Philippines, Dr. Rowena Guevara. Actually, she is a Deputy Minister of Science and Technology in Philippines, but unfortunately, she has a important commitment in last minute, so she canceled her trip. And today, actually, we have, I would like to introduce our distinguished guest, President Tran Tet Tuan. Actually, I just mentioned, actually, he is president of University of Medicine and Pharmacy, Ho Chi Minh City. And this one, actually, we have a former Deputy Minister, Professor Zheng Jian Chiu. And the other important guest, actually, from Malaysia, Dean Azwan Abu Osman. Actually, he has been my long-term friend already, and he actually demonstrate the great leadership in established College of Engineering for University of Malaya. And he also president of Malaysia Society of Biomechanics. And we also have a former president of Taiwan Medical and Biotech Industry Association, Go Yisong Go. And he also is an adjunct professor of National Taiwan University of Science and Technology. And actually, he is a representative from the industry, and especially can share with you the aspect from the industry point of view. And we also important the other one that's on my left-hand side, Professor Wang Zhaolin. Actually, right now he is a president of Taiwanese Society of Biomedical Engineering, and he also have a great research in medical devices. Right now he is a professor on Department of Biomedical Engineering, National Taiwan University. So probably we can ask our guest to share with you some experience first, and then in the end of a presentation, you can, all the audience can ask the questions. Okay, probably we can ask our, President Tuan first. Then probably, actually in Vietnam, they usually to call the people's name the first name, not the family name. Is that a Vietnam tradition? Probably I introduce more in detail. Actually, President Tuan got his PhD training at University of Tokyo, actually 2003, and postdoctoral training at National Institutes for Physiological Science of Japan, 2003, and University of Michigan, 2003 to 2005. And actually, he's a fellow of Asia Youth Fellowship, and also a lot of fellowship and also honors, And I think I met President Tuan probably 2 years ago, and I was impressed, by his leadership, and I think he is the most potential and capable president in Vietnam. Okay, probably President Tuan can share with you his aspect about the technology collaboration between Southeast for East Asia.
So thank you, Professor Sru, for the introduction. And I would like to say thank you for inviting me to join this very special event. This is the inaugural event of Yushan Forum. So it's the first one. So it's my pleasure and honor to be here. And thank you. So I would like to say about from our perspective from regarding this forum and how we can collaborate to each other. So from this forum, I learned the Taiwanese government have a new southbound policy, and there are 5 flagship programs. And I think based on this, how can we use this momentum from the Taiwan government, and it can benefit to Vietnam in general, and also to, of course, to our university in particular, but in general, more general to Vietnam and also to the Southeast Asia. So in UMP, our university, my university is University of Medicine Pharmacy in Ho Chi Minh City. We can consider this is one of the biggest university in health science in Vietnam, and we are in the south, in Ho Chi Minh City, the former Saigon. And we are a comprehensive health science university. And when I listened to the presentation today in this conference and this forum, I saw a lot of things that fit well to our mission and vision. And right now we try to, although we are quite behind in the region in terms of follow the trend in education and training, but we are trying to do our curriculum reform. We try to improve our governance based on the quality assurance standard, the regional standard, at least in the Southeast Asian standard. And also we try to integrate into the region, we try to integrate regionally and internationally to improve our quality of education and training. So right now, regarding the international relation, we have more than 60 active MOUs and agreement with many university institutions around the world. And in Taiwan, we also have many MOU, I mean collaboration with many universities in Taiwan. And so in this forum, and based on the new southbound policy, what can we do from our part to use this as a force to improve our education, training, and get to benefit to our healthcare system. So I think for UMP, there's many areas that we can, and also for the Vietnam, we have many areas that we can focus on. For example, we can improve the soft power. I mean, how to improve the education and networking between institutions, university, between Vietnam and Taiwan, and of course with other Southeast Asia countries. And how to involve the private sector, which is very weak in our country. In our country, still, the communication, not to say about the industry, the communication even between the health system and the education system is not really good. So for industry, it's even worse, academy and industry. So this is when we visited Taiwan for many times, and in the last year, we saw this is really a good model that we can adopt into our country as well. And then how to develop a customized program to improve our education also. So so to mention this, I would like to say UMP can be a window, one of the windows to connect for Taiwan to get into Vietnam, and also for Vietnam to get into Taiwan. And UMP would like to play a real role, a real window in this process. And so there are many medical devices that we use in Vietnam in our healthcare system, and many of them come from very high standard and very expensive, from Europe, from the United States. But my experience when I visit Taiwan and the University of Cheng Kung University, and also the Taiwan Southern Science Park in Tainan, I saw a lot of very good, high quality product, medical devices. And I think the price is quite reasonable. So I just think, for example, in dental care, the implant, we use the implant, the device is from the United States and Europe. It's very expensive. And right now in Vietnam, only the rich people can really afford to have that kind of, we call this kind of luxury service. So if we can use some product, the Taiwanese product is also a very quite high quality, but with a low, reasonable price, then more people, I hope, more patients can be benefited from these collaborations. So that's my impression, and we truly hope that our university can be a real partner, a real window to connect Vietnam and Taiwan. So thank you very much. Yeah.
Thank you. Next, I would like to invite our former Deputy Minister and
perhaps Professor.
Okay, it's okay.
First.
Shyh Jye. Actually, right now he is a distinguished investigator, Institute of Cellular and System Medicine National Health Research Institute, and actually Professor Chu actually have outstanding performance in research, and actually he received 3 times distinguished research award from most, and he made a great contribution in bioengineering and clinical medicine. Okay.
Thank you very much,
Yeah.
honored Chairman, Deputy Minister Chu, and distinguished guests and ladies and gentlemen. It is really a great honor for me to be invited as a discussant in this session, and we have just learned more about the Ministries of Science and Technology's effort to promote technology innovation, and in particular, Professor Deputy Minister Su mentioned a lot about the support for the research and development of innovative medical devices, as well as their actions on promoting the new southbound policy. And here, I would like to say that biotechnology is the only industry in Taiwan to benefit from specially legislated R&D investment incentives. In 2007, Taiwan adopted the Act for the Development of Biotech and the New Pharmaceutical Industries to encourage investment in the R&D of new drug and innovative medical devices. And this Act provides a certain percentage of expenses for personnel training and R&D to be offset against enterprise income tax. So I think that the biotechnology, particularly innovative medical device, is highly regulated product, and I would like to say that Taiwan has actively harmonized its regulation for pharmaceutical and medical device review and clinical trials with international standards such as ICT guidelines. And now we are the full member of PICS. We have more than 120 pharmaceutical and medical devices companies that have passed PICS GMP, and particularly we have very strong clinical trial capabilities, as mentioned by Deputy Minister Su just now in their excellent, outstanding presentation. So I think that the number of applications for clinical trial is stated more than 700 cases per year. So actually, Taiwan is a very good fundamental base for different countries to study biomedical industries through the good clinical trial environment. To promote the innovative medical devices and technology industry chain cooperation with Southeast and the South Asian countries, I would like to be on behalf of Taiwan's Ministry of Health and Welfare to say that we have been developing a very favorable regulatory environment that is consistent with that of these countries. And here I would like to give a brief introduction to the efforts we have done and we are doing. First, we will continue to review the regulations and the current medical devices requirements of new southbound countries to help manufacturers to enter the markets of these countries, and we will post the regulations and the differences between Taiwan and these countries on the website for every sector's reference and use. And the second, Taiwan has actively participated in global harmonization activities for medical device regulations and have revised our regulations following international trends. For example, our participation in the IMDRF, International Medical Device Regulators Forum, and the AHWP, Asian Harmonization Working Party, will facilitate our understanding of the global medical device regulatory trends and the revision. And the last, I would like to mention that Taiwan's Ministry of Science and Health and Welfare have called New Southbound Policy flagship program just mentioned by Director General Zhou just now. And this program named Medical and Public Health Cooperation and the Development of the Industry Trends. And we focus on 4 connectivities, which are soft power connectivity, supply chain connectivities, and the regional markets connectivity, and the people-to-people connectivity. So we believe that bilateral and regional collaboration with Southeast and South Asian countries to enhance the harmonization of medical device regulations and the pharmaceutical review practice can help build useful relationships between Taiwan and these countries to promote medical industry development and global market expansion. Thank you very much.
Okay, thank you, Professor Chu. Next, I would like to invite Professor Dr. No Azwan Abu Osman. Actually, Dean Osman graduated from University of Utrecht, United Kingdom, and he played a key role in promoting biomedical engineering education in Malaysia, and he established engineering industry innovation center worth of 230 million Malaysia dollar in value generation at University of Malaya. And he also set up one company, so-called BioApps in University Hospital, for prosthetics, design, and orthotics. So actually, he have a great experience to link, academic research to be applied realistic, in hospital. Okay, Professor Osman.
Thank you very much, my old friend, Deputy Minister Su, Director General Jerry Cho, panelists, ladies and gentlemen. Can I request to start my PowerPoint, please? It's just about 4 PowerPoints. I prepared it for the last half an hour. Right, my name is Azwan. You can call me Azwan. I'm currently the Dean of Engineering. I'm from the University of Malaya, Faculty of Engineering. University of Malaya is a research-focused universities, research-intensive universities. We have about 27,000 students, 12 faculties, but I'm from Faculty of Engineering. Well, the reason I'm here is not to explain about University of Malaya, but more on sharing my experiences regarding value creation. Deputy Ministers to always, when he met me, he always asked me, how about the value creation? Do you have enough money? Do you get more money or what? So whatever it is, today I would like to share with you what is my experience in University of Malaya. Well, I'm a practicing engineer. At the same time, I'm an academician and the professors in the Faculty of Engineering. I think it's very interesting to be discussed today. It's also about the technological innovation. And I would like to start with this. I would start with what I call as Industrial Innovation Center. Well, for the last panelists, I think last session, I think the panelists did mention about ranking. Right, I'm not going to show about numbers, how we move from 213 to 35, but what I want to share with you, how we move to that numbers. Yeah? Of course, we have a 5 paradigm shift. We call it a 5 paradigm shift, but what I want to highlight here is all about university and industry collaboration. So that is the things that I would like to share with you today. We call it as an Industrial Innovation Center. And at the moment, we have 7 industries in the universities. Yeah, we have one is R.O.C. R.O.C is the biggest, second biggest artificial limb manufacturer in the world. And we have a Motorola, the telecommunication companies. Road and Shores is a US-based telecommunication companies. Daikin is the biggest aircon manufacturers in the world. We have a Proton, local car manufacturers. Huawei is the telecommunication. And of course, recently we have MDIC, Medical Device Innovation Center for NCKU in the University of Malaya. So this kind of thing, we have industries in the university, we give a space to the industries and they set up their facilities, they put their equipment, they put their engineers and run it in the university. You know that we want, University of Malaya is a research-focused university. We have a brain, we have a students. So whenever industries have a problem, the quickest way to solve the problem, just send it to the universities. Because why? The university will take that kind of problem and solve it through their master's project, through their PhD project, and through their journal publication or whatever thing. So at least the company will get the result with scientifically proven. It's not only the product, but product with a scientifically proven. So that is all about in University of Malaya. We are targeting to generate money or value creation of about 230 million Malaysian dollars, or more or less about 60 million US dollars in the next 5 years for this kind of collaboration. University of Malaya, recently produced, not to say, in University in Malaysia, produced hundreds of patents. Yeah, either it's international patents or national patents, but I have to be honest here, only about less than 10% that been commercialized. Yeah, so this is, I think, is quite common all over the world, but we need to find ways. We need to find ways how these kind of products, and how this kind of product can go to the market. I think the weakness of every university, especially in Malaysia, I guess, we are not very strong in doing marketing. So that's why the country like Taiwan is very good in this kind of things. We want to do this kind of collaboration. So in Malaysia as well, the government of Malaysia allowed the academic staff to open the company, of course with permission. They can open the spin-off company, they can open the startup company and run it the company. Of course, they cannot be a CEO, they can be an advisor, they can be a shareholders. But the point here, this is one of the way how we want to products from research to commercialize it or to be retailed. One of the way, because you have your own product, I'm sure that you want to see your products to be commercialized. And another thing that probably can help with this kind of activity is creating what we call it as a business hub. In this case, the University of Malaya and the National Cheng Kung University have established a business hub, a medical hub in this faculty. This is what I call National Cengkoo University and University of Malaya, Gaya Hub. That's why the Deputy Minister has always mentioned about Gaya Hub. This has been officiating, I think, last September. This is all the same pictures that Deputy Minister showed it to me. But one thing I would like to share with you with this kind of activities, almost, not to say almost, many Taiwanese companies which want to enter to the Malaysian market, they have to go to this kind of hub. That is, I think, that's hopefully one day we will achieve that. The reason why using this through hub, so it can go easily to Malaysian market. But we don't know how success it is, but we are working toward to make sure that the Taiwan's product, be used in Malaysia. I like to get attention. The President did mention just now that the price, the Taiwan product the price is very reasonable with high quality. But we need to somehow train the Malaysian peoples to use Taiwan product. It's not so easy because they get used with the European, in the US product. But now it's the time. If we can prove it to the, especially to the Asian, that the Taiwan's product is good, I'm very, very sure they will use it. So I think this hub are able to leverage research capabilities and expertise. And of course, we'll be able to develop a new, what we call is a funding stream, and creates a win-win for all parties, either at the universities, either at the companies, or either in industries. So probably I would suggest to Deputy Minister Su, if possible to somehow create G2G, the government-to-government hub for industry, and thus can introduce strong dynamic partnership within the country. With that, thank you very much.
Okay, thank you, Dean Aswell. Okay, I think we know that right now our government, especially our Prime Minister Lai, highlight it's important to listen the voice from the industry leaders. So next, I would like to invite Dr. Go Yushan. Actually, he is the president of Comtech Industry Corp. His company develops medical device over 30 years and focus on diagnostic and healthcare applications. And in 2011, he was elected as the chairman of Taiwan Medical and Biotech Industry Association. I think it's great, to have Dr. Go join this panel discussion. Yeah, Dr. Go.
So first of all, thank you so much, Professor Su, to invite me to attend this Yushan forum. This is my great honor to attend, to talk with each other. So ladies and gentlemen, good afternoon. I come from industrial. So I would like to take just a couple minutes to share my experience and my opinion to the point of the view, to look at the Taiwan industrial trend. So overall, the industry trend within the 30 years changed a lot from label provider to technology, due to technology. So the key issue is a human resource and ecosystem that reflect to the government policy and good infrastructure. Otherwise, we cannot do anything. So today, due to the technology, every day is update and update. So smartphone is very, very popular around the world. Also, it's a change all of the people behavior and change the world. So due to the technology, break the distant, the boundary and the country boundary. especially internet. The internet we call the IoT, that changed a lot. So when we are talking about the biomedical industry or innovative medical devices, that we always to looking for to develop advanced medical device to supporting a human better life. So from global aging the population structure, especially Southern Asia, that we can find the healthcare, the market demand always increase. So in the meantime, how to think about that to create a business model. That business model is create a mutual benefit with international partner to cooperate, to work together. That will be more and more important for Taiwanese manufacturing. So when we would like to talk about innovative medical devices, we need to think about how to create innovation. That innovation means open innovation. If we can find out the best solution through the open innovation, that means if we can cooperate with international partner to work together, that could be to use the resource for each other. So finally, Taiwan is an island. Taiwan also is a technology provider, but we need to work together with Southeast the country. So should be too active to promote in this area to find a win-win situation. That's my opinion. Thank you.
Thank you, President Go. And the last guest, actually, from National Taiwan University, and Professor Wang Zhaolin. And he is president of Taiwanese Society of Biomedical Engineering. I think we can listen some experience from academic aspect. Okay.
Okay. Ladies and gentlemen, it is my great pleasure to be here. Thanks to Professor Su. I think Professor Su gave a very thorough and detailed insight about the biomedical industry and the research in Taiwan. Here, I would like to give my personal experience and my personal expectations about the biomedical industry or research in Taiwan as educators, as researchers. You know that for the biomedical industry, we have one roof and 3 pillars. The roof is the need, so-called the unmet need, or the innovations which came from. And the 3 pillars is the regulations, the patents, and the market. With all these things, it's different between the advanced countries like the US or Europe, and with respect to the low-income country or the developing country, the interest will be different. For example, for the unmet need, okay, in the Europe or in the States, probably they are more focused and more interested on how to advance their MRI machine, how to advance their brain surgeries, how to advance their cancer curing therapies. But for the developing country, for the low-income countries, for the third world country, probably the the decrease of babies' infertility, babies' death rate probably is more important and more desperate for their countries. Because, for example, with the decrease of baby death rate, it can elaborate the woman's health, elaborate the woman's life careers even. Okay, they can put their time and the life in addition to regenerate the next generations. So the interest would be, even the innovation-wise, is different from the Asian countries with respect to the States or Europe. And how about the three pillars? The regulations, patents, and the market. The regulations-wise, okay, Taiwan is probably the leading country next to the Japan in medical regulations. I think the TFDA in Taiwan, okay, is established in about the year 2005 or 2006. It's already 10 years old. Okay, even with that period, okay, it's still the oldest food and drug administrations in Asia. And I think we have a thorough experience in formulating the regulations in the medical devices. And I think we can share the experience we had with Asian countries. And regulation is kind of the way to promote, to guarantee the medical devices qualities and protect the human health. But at the same time, okay, it is also a tool for countries to forbid other countries' devices import to their own countries. So it can be a pro or it can be a con. So how to make the judgment of the levels of the medical devices regulation is really not only the not only the purely of the science, is also kind of political issues. So I think Taiwan has kind of at least 10 years or 15 years of experience can share with countries in Asia. And how about the patents? Patents, okay, I think all the patents, I think at least in Taiwan, when we talk about patent, we talk about patents in States, we talk about the patents in Europe, we talk about the patents in China. And but we never had experience of the patenting in Asian countries. I think probably that is an issue. Okay, we should focus on the patent issues about Asian country and Taiwan. How can we have a bilateral consensus about the respect of our patents? Okay, so then we can protect the product of each side. And then third one would be the market. The market size of the Asian country is as large, the GDP is as large as Europe unions, and the population-wise about 1 billion. So it's a very huge and big market. So I think we cannot ignore the size or the amount of these areas. So there's no problem with the market, and I think we need to improve with the regulations, and we need to negotiate with the patent issues. So, as the president of the Taiwanese Society of Biomedical Engineering, our society is focusing on the two things. The first is to promote to guarantee the medical devices quality, and then with these qualifications, we can promote the patient's welfare. And how to do that? And one of our major issues is to promote the regulations of clinical engineers. With only the clinical engineers, we can put them in the hospitals, in the industries, so we can guarantee our medical devices are qualified and they can be used in the patients. We need the buffers, we need the quality controllers for these devices. So that's our missions for our societies. And as professors in universities, we have 3 missions. The first one is the research. So I think, okay, even though, okay, Taiwan, okay, the national impact, I have to admit that, okay, is gradually degrading. But we are still the top 100 university among the world. I think our research is not. I will not say compared to the research in the States or Europe, but I think our research-wise is very close to the human, very close to our patient. Is also very close to we so-called the translationals. So our research can be, I mean, our focus can be more focused on the patients, on the medical devices, but not rather in the really so-called cutting edge on the Nobel research. We are not allowed, we don't have that kind of luxury to do that kind of things. But with advance of our research, and I think we can collaborate with the most universities in Asia countries, and I think we have these advantages that we are more, as Professor Su said, okay, in Chinese, in Taiwanese, it's called 接地气, means that, okay, we are more connected to our peoples, we are more connected to our industries. And educations, our second mission is educations, okay, and I'm now the deputy directors of the National Taiwan University of the Medical Development and the Research Centers. We just hold eMedic Globals. It's a student competitions for the medical devices. We invite more than 10 countries, from Singapore, from Hong Kong, from Australia, from England, from Japan, to come to our nation to have students to present their work in their classroom, and to show their product here. I think this kind of education purpose, but then with this kind of event, okay, we can have a student get together, and I think the future is theirs, and we provide the event, we provide a place, we provide a conference for them to know each others, and then they can be our futures. And so for education purpose, I think we need to provide a platform for our next generations. And the next one will be the service, okay, and I think our service in the university is to transmit our technology to the local industry for those who is not so well equipped, and we have forums for the industries, and we also give our we also advocate for our government. If our government has any policies, we can give messages to our local industries. So in this, I end my 5 cents opinions about biomedical research and industry in Taiwan. Thank you.
Okay, thank you, Professor Wang. And I think probably every guest actually share their experience. But now we can open some questions from the audience. Any questions from the audience regarding technology innovation? Okay, please identify you first before asking the question. Thank you.
That's it from Thailand. I think practically the whole afternoon, not even one word was being mentioned about access to medicine. And maybe Taiwan is the only country that patented or expensive medicines are available in a very affordable manner. So any idea about medicine for cancer, for heart disease, or contagious disease, and so on, how is it that all of these are available in Taiwan? And what did you do with the big companies, corporation, pharmaceutical company that sell very expensive and would like to expand, to extend the patent period under the FTA or investment protection negotiation and so on? How do you cope with that in order to provide affordable medicines to the ordinary Taiwanese people? I think this is a problem for Asia, Latin America, and so on. All over the world, we have the same problem of being subjected to the demands and pressure both of the Western governments, including Japan, and the big pharmaceutical corporations. Thank you.
Thank you. Question. Probably, I think I can answer the question first. Actually, yeah, I think it's very important that in this forum we don't only pay attention to the medical devices. The pharmaceutical and the other issue are, most welcome. And yeah, I think we know that medicine is quite expensive. For example, in Taiwan, as I know, we pay about 160 billion dollars per year, for drug, through the health insurance company. A lot, actually cost a lot. Actually, we have a representative from Ministry of Health and Affairs. And yeah, you mentioned that you asked the medicine, especially for cancer, for heart disease, actually is very important. So in Taiwan, actually, in addition to new drug development, actually Taiwan government spend a lot of budget, in stimulate the development and clinical trial for new drug. But we also have many companies, actually they manufacture so-called Shyh-jye. That means the drug actually without any protection of the patent. But the Taiwan company, several companies actually are good in manufacturing those drugs. So, and it's very important. For example, we have a so-called the teamwork from Taiwan pharmaceutical company try to have a link, have collaboration with Japan, because as I know, Japan government actually encourage you to use the drug, without the protection of a patent, because due to the cost and the reduction. So I think we have an important association in pharmaceutical, medicine. So probably, we can, if you are interested, you can, I think the representative just by you, can provide some more link and advice. Probably, we can have some comment from our former Director General, Professor Shyh, from Ministry. That's actually, she's a former Director General. Yeah, you may microphone from Ministry of Health.
Yeah, okay, let me explain a little bit. Basically, in Taiwan, we have so-called National Health Insurance Scheme. This is the single pipe, the only one buyer of medicine. So Deputy Minister Su just mentioned that each year we spend, almost 1/4 of our total, the National Health Insurance expenditure for medicine, okay, for pharmaceuticals. I think previously most of the medicine, they are chemical or biological products. Okay, it's if we are talking about, the price, it's quite okay, affordable through our national health insurance scheme to reimburse. Basically, we almost, reimburse, all the items. But as the technology develop, okay, as we know for cancer, especially for cancer, first we have target therapy. At that time, we think, the cancer drug is expensive. But unfortunately, now, cancer drugs, we are talking about, the immunotherapy, okay? That's very expensive. But let me give you the example for hepatitis C, the new drug, which can cure, almost we say it can cure the hepatitis C, but very, very expensive. And now, our bureau, National Health Insurance Bureau, are through quite a lot of, negotiation with, the provider. Then, of course, you can see through the negotiation, the single buyer, okay, quite powerful instrument. But even though now, gradually the so-called immuno-oncology product is coming. Very, very expensive. I think not only in Taiwan, but also all the, even in United States, previously, because they do, US do not have the single pipe like Taiwan, this kind of health insurance system. So even they have the private, private insurance company. For such kind of expensive product, they face the very difficult situation, for all the private health insurance companies in United States. And in Europe, most of the European countries, they have the health insurance system. They also face the same difficulties. I think next month, coming so-called ISPO, that's from the very economic, evaluation technology. I believe they are going to discuss how to pay for the coming very expensive product. So not only Taiwan, but also the European countries. But I don't know, I'm just thinking that can we collectively, cooperate to become, to negotiate with these kinds of pharmaceutical companies. In Taiwan, of course, we are single buyer, but can we combine with other countries, sit here, maybe in the Southeast Asia, and negotiate, okay? We need to think about, some kind of method. Maybe, right? Why not Thailand with Taiwan, and even with, with Vietnam, with Malaysia? That's, it's an open question. And it's a difficult question we face. Thank you. I already retired, just former minister. Yeah, but still actively involved with our national health insurance system. Thank you very much.
Yeah, actually, Professor Cho,
I would like to add some point on this issue. I think that regulation harmonization may be very important to reduce the cost. For example, most of the countries in Asia just adopt request the BE test for the biomedical devices. So for genetic drug. So such as Malaysia, it promotes the use of so-called mutual recognition arrangement for bioequivalence study reports. So the mutual recognition of the regulations and to develop the medical device or drug may be important to reduce the cost. So if you do the clinical trial in this country, and if you have some mutual recognition of the data, then it can save the money, I think. This is the important way to go.
Okay, President Tun want to add something.
Yes, I just want to say from a different aspect. Of course, for very specific therapeutic approach, like we mentioned about the big company he mentioned, like immunology therapy or immunology oncology. So it's very expensive. For that one, I just would like to say from different aspects, mean here as for that one we cannot do anything. I think from my point of view from Vietnam. But is there any other things that we can afford, but is available around Asia? Like for example, like I just mentioned in my previous talk about the implant. The implant is very expensive, but if we have something is similar, but it's already approved to use somewhere else, and we can use in our country, but it's cheaper. Why don't we use that? So for immunotherapy, I don't say I mentioned about that, it's already different category. I just mentioned it from a different part. Like artificial knee, for example, the knee. It's very expensive. From United States, it's very expensive. But something else, maybe from Taiwan or maybe from other country in Asia, is cheaper. Why don't we use? If that is, of course, we still need to be approved to use in human being. We need clinical trial. In Vietnam, we have regulation that even for any medication or medical device would like to use in Vietnam, we still have to conduct clinical trial, even it's already approved by FDA. But if the device already approved in other country, it's more easier to get into our country. So we still have to do clinical trial in order to approve the products. But here I just want to say we can look at different kind of therapy that is affordable in Vietnam, let's say, from my point of view. So yes, that's it. Yeah.
Okay. Yeah, just a short one. Probably I can add on that. Well, the price is expensive. The drug is expensive because we set the price expensive. No, it's not because of whatever thing. We are the company or industry set the price is going to be expensive. So that's why the price is expensive. I think the point here, I tend to agree with just now that somebody mentions about the MRE. I think we must find ways to establish this kind of MRE, the mutual recognition agreement, for example. Will reflect to every country, and therefore the price is going to be reasonable. So I repeat it again, the price expensive because we set it on the higher side. I think the industry can set it in the lower side if the industry understand the needs of the patients or the countries. Thank you.
Okay. Yeah, Professor Shyh.
Okay, I agree. Okay, for regulatory mutual recognition, this is important part. Okay, especially for generic products. Okay, it can cost down, but I think for the new product, especially new drug, it's a little different from new medical device. Okay, new drug, unless you do not have the patent protection. If we have patent protection, then it's a single source. It's very difficult, unless patent expire. Then we can come up with generics, then can cost down. But for medical device, yes, I agree with the president. Yeah, maybe a little different, then you can escape away from the patent. For new drug, if it is the new chemical entity, such kind of concept, then unless, we have the compulsory licensing or I don't want to give the example, say, for example, hepatitis C product, okay, it can cure. So quite a lot of people want to go to Bangladesh to get this product. So you can imagine what's the difference. Thank you.
Okay, due to time limitation, probably we can allow one more question. Okay, any questions from the audience? If not, probably I think our guest actually share with you a lot of experience, especially I think so-called ecosystem and human resources actually play important role in share the experience. So I think the Yushan Forum actually is provide a very good opportunity, for a common dialogue. I think that the common dialogue very important. Is very important because we now understanding each other. You don't know, you never know the realistic need in the other country. So I think only through the common dialogue, then we can understand the local needs, in each country. So probably, I would like to invite all invited guests, to give final word again from the right hand side. Yeah, from the Dr. Go.
Thank you. Yeah, talking about the medical devices, I really appreciate, I call the new government or current government, spend a lot of effort to support all of the manufacturer to develop a new product. And I believe this is a future for the Taiwanese industry, especially bio-industry, because the Taiwan medical device company within the 5 years has always increased. The number always increased more than the 10 or 20%. Supposedly 5 years ago, just only the 500 company, but now over the 1,000, especially startup company, to develop the advanced medical devices. So we need to cooperate with each other, even the academic university and across the country, to find out a partner to do and to create value added. This is a medical device. Thank you.
Thank you very much. Just a conclusion from me. Maybe I still believe the life can be better if all of us work together, especially in creating medical products. So to create the medical product, I think one of the ways is to create the medical hub. In order all of us can talk each other and make sure that we are in the same direction. Thank you.
Thank you very much, Professor Zhu. I believe that international regulatory harmonization of the medical product has been a key policy development in Taiwan. So we are very happy to make a cooperation with Asian countries on promoting the harmonization of the regulation in medical device and drug development. Thank you very much.
So I think there's a great opportunity here, and how to we work together that we can bring some application that can benefit more patient and in a less advantaged population.
Yes. Yeah, Professor Wang.
Yes, as I mentioned, I think we share the similar medical interest. And with the advance of the regulation harmonizations, with the negotiation of the patent issues, and we already have a very big market there. So if we can all solve these things, I think we'll be success. Okay, thank you.
Okay, and finally, actually, I would like to appreciate all distinguished guests, the panelists, for their sharing valuable experiences. And also thanks to all the audience for your participation and asking the questions. I think Yushan Forum actually play important step, to promote so-called actually link, to Southeast and East Asia country, especially like Dean Aswan just mentioned that government hub. I think so. Like Professor Chu just highlight actually the regulatory harmony or regulatory recognition. I think between Taiwan and the other country actually play important role to break the barrier in regulation application in different in foreign country. And I think each country has a different demands, and especially but in Asia actually I understand that the affordable high quality product actually are most required. So actually Taiwan just fit and Taiwan own this kind of strength. So I think the continuous collaboration is in terms of science and technology collaboration, even education collaboration. I think we can create a lot of value in near future. And I expect to see the bright outcome. Thank you. Wish all of you have a nice evening. Thank you for participation. Thank you.